So, heart disease is still the leading cause of death in women, and yet it's one of the most misunderstood topics in women's health, especially in midlife. Most women think heart disease is something to worry about later, or that it looks like dramatic chest pain. But for women, particularly during the menopause transition, that's often not the case. Today, I want to explain why midlife is such a critical cardiovascular window, why symptoms are often missed or dismissed, and what actually matters when it comes to prevention. So why midlife is a cardiovascular turning point. Midlife isn't just a reproductive transition. It's certainly a cardiometabolic one. And during perimenopause and menopause, estrogen levels fluctuate and decline. And estrogen plays a role far beyond periods and hot flashes. It affects blood vessels, flexibility, lipid metabolism, insulin sensitivity, inflammation, and stress response. And as estrogen protective effects change, cardiovascular risk accelerates, independent of chronological aging. And this is why women often experience shifts in cholesterol, their blood pressure, weight distribution, and glucose regulation during this stage of life. Midlife isn't when heart disease suddenly appears. It's when risk quietly accelerates. So why women's heart symptoms look so different? Another reason that heart disease is missed in women's is presentation. Women typically develop heart disease about 10 years later than men. But when it shows up, symptoms are often less specific. So instead of your typical crushing chest pain, women may experience things like fatigue, heartburn, poor sleep, shortness of breath, palpitations, anxiety, or a sense of unease. These symptoms can overlap with perimenopause symptoms, which is why women are so often told it's stress or anxiety alone. But that doesn't mean anxiety isn't real. It means symptoms deserve context. Different presentation does not mean less serious. What about palpitations, hot flashes, and cardiovascular signals? While palpitations are one of the most common cardiac symptoms during the menopause transition, up to 3/4 of midlife women do report them. They're usually benign and not associated with structural heart disease, but they're strongly linked to vasomotor symptoms, hot flashes and night sweats, and to sleep disruption and stress. What's important here is pattern recognition. Research shows that severe or persistent vasomotor symptoms, early onset of symptoms, or symptoms lasting many years, that those are associated with increased cardiovascular risk. And symptoms aren't just nuances. They can be early signals that deserve attention. What about normal tests? Well, we know they don't always mean no risk. So one of the most frustrating things that women hear is, your tests are normal. Lab imaging or snapshot. Risk is trajectory. And during midlife, changes in cholesterol, blood pressure, insulin sensitivity, and vascular function may not cross thresholds immediately, but they do matter. And this is why symptom history, reproductive history, pregnancy complications, age at menopause, these are all increasingly recognized as cardiovascular risk enhancers. Heart health assessment in women must include menopause status. Prevention without panic. So Heart Health Month isn't about fear, it's about timing. Midlife is a powerful prevention window. Lifestyle intervention still matter deeply. Things like movement, nutrition, sleep, stress regulation, smoking cessation, and when appropriate, medical management should be individualized. The goal is not perfection, but it's awareness, early action, and partnership in care. Midlife is not a breakdown, it is a pivot point. When women understand what's happening in their bodies, they're empowered to protect their long-term health. So if this helped you connect the dots, make sure you subscribe, save, share with someone that is also navigating midlife.